she's known by me, my yin, Miss Martha, I don't even do your last name. McClellan-Morehouse. It's hyphenated. McClellan-Morehouse. M&M. So she's the yin to my yang. Last year we did a lot of work for the program chairs here, and she has agreed graciously to come and talk to us about a very important topic, women's health, and specifically the menopause and transition into that time in the life, which is very, very mysterious, I believe is one of the words we use. It's mystery. So she's done a lot of work down in LA. She has been licensed for many, many years. She served with the LA County Mental Health.
Well, actually, independent and non-profit.
Yeah.
Contracted.
So lots of work, lots of history, and then she's up here now in the Sacramento area to promote her own book that she has written. She has, which will be available for sale during her time here, and step into it. She holds you warmly as you go through therapy, and you just gain so much wisdom and insight. And she is going to teach us everything we need to know about menopause today. So, without further ado, Miss Marti. And will you do a peaceful moment for us?
Thank you for that introduction. Good morning, SVC family. It is, thank you. Good morning, SVC
Good morning.
family.
Good morning.
And visitors and friends. I am here today to talk about this very delicate and wonderful rite of passage. But before I get started, are there any new graduates in the room? Newly licensed? Yay, congratulations. Congratulations to you. And happy belated Mother's Day to those of you who have mothered your own children or somebody else's child. And from this place, like many mothers do, I would like for us to join together today, heart to heart. And also, in honor of Mental Health Month, I want you to join me in a breathing exercise. And before I invite you to stand up, I just want to demonstrate. As you breathe in, I want you to blow up the balloon that is your belly. And as you breathe out, say, ah. So please stand up. We're going to do it 3 times. So as you breathe in, please blow up your belly and do the gestures. So breathe in. And breathe out. In and out. In and out. And you can please sit down. Okay. And you can use this to help you get centered in your body, and also teach your clients this technique to help them to get centered in their bodies, and it helps to reduce anxiety as well, and also to connect you with your clients, or of course you with yourself. And now that we are connected and centered and grounded, let's have a dialogue about the menopause transition. My birth name is Martha. However, please call me Marti. And as you can see, I have a list of credentials. But please pay close attention to the last one. Wife, mother, hot flash lady, and power surge queen. My husband is here today to help me to be supportive, and we have 2 wonderful children. One down in Southern California, looking to become a health and well-being professional, and our daughter is up in the top of California, working with youth, trying to keep them out of the prison system. But I want to define the last 2, which are terms that I coined to describe women dealing with menopause. Hot flash ladies are women learning to navigate the challenges of the menopause transition. know that I had started menopause when I started. And my doctor said I was too young. My therapist didn't even mention it. And I was clueless, I had no idea. But it was one of the most difficult times of my life. I basically self-diagnosed, self-medicated, made a lot of poor choices, felt terrible most of the time, horribly depressed, anxious, forgetful. I forgot to pay my mortgage like 3 months in a row. Yeah, you knew that, right? Anyway, but fortunately, we had it set up so that there was money in savings that covered it, so there were no penalties, but it was pretty serious. So going through that was just very, very difficult. And Power Surge Queens are women who have learned to harness the energy, the power of the menopause transition and beyond. Hence, the ensemble. I no longer feel like I have to wear my power suit to be in front of a room like this one. Our learning objectives today: raise awareness about the complications of the menopause transition, explore the challenges for women who are experiencing these changes while they're parenting teenagers, adolescents who are going through their own changes, and to improve the mental health care that we provide for these women and help them to step into their power. The presentation is for professionals whose clients include these wonderful women going through the symptoms, impairments, and tragedies, as well as the triumphs and the victories. And we want to advocate on their behalf. Perhaps we can start some of that or continue that conversation, because it is happening, although we don't always hear those conversations. So we want to advocate on your behalf as well. Perhaps some of you are going through your own challenges and difficulties related to menopause, and to share wisdom. Remember, this is a dialogue. I am not up here to preach, teach, and talk alone. So please, everyone, join in this so that we can expand our toolkit. I'm sure there are things you know that I don't know, because not every scientist knows the same thing, or every doctor. So I am sure you have wisdom to share as well. Let's talk a little bit about trends. First birth trends, specifically. For the past few decades, many women in the United States have chosen to have their children at a later age. Some are having their first child in their 30s and their 40s. And so that I am not the only one talking, I would appreciate it if someone would read these statistics about first births. Now, this is from a CDC NCHS report, so who will volunteer to read these statistics for me? And they're important to hear out loud. One thing I've learned about PowerPoints is you don't really need to read everything there, but these statistics I would like to be read out loud. Anyone? Well, your hand is first, so if you don't mind, please.
First birth rates for women aged 35 to 39 rose in nearly all states from 2000 to 2012. Shall I just go through all of them?
Yes, please.
The first birth rate for women aged 35 to 39 rose 40% or more in the District of Columbia, New York, North Dakota, Oregon, Rhode Island, South Dakota, Washington, and Wyoming from 2000 to 2012.
Now, all right, bad joke, but I actually thought, well, could some of this be based on red or blue states? But, I mean, really, I had a moment, but no, it isn't until I checked. But go ahead.
During this same time period, the first birth rate for women aged 35 to 39 increased 30 to 39.9% in 9 states, and from 20 to 29.9% in 21 states, including California.
That's pretty significant. That's pretty significant. Go ahead.
First birth rates were essentially unchanged in Arizona, Idaho, Mississippi, and Oklahoma from 2000 to 2012.
Back to the red and blue state choke, but no, okay, I'll stay away from that. And this is just a map. I'm sorry that your black and white copy doesn't necessarily show the colors, but it's, basically I think you can see some shading. We tried to do a gradation of grades for you, but, just important. If you choose to travel out of state or work out of state, it's just, something you might want to know about, what's actually happening with women as they're choosing to have children later on. And maybe someone else would read this particular page, still a part of the CDC NCHS report. Anyone?
Okay. 33 states and DC had an increase in the first birth rates for women aged 40 to 44 from 2000 to 2012. The first birth rate for women aged 40 to 44 rose 60% or more in the District of Columbia, Minnesota, Nebraska, and South Carolina.
That's a lot of women having children between 40 and 44. Yes. It's riskier, but they do say that because of the level of education and maturity, that it's actually a good time for women to start to have children. But that hot flash thing, when that starts happening, we'll talk about that later, but please go ahead.
15 states, many in the Midwest, had rises of 40 to 59.9% in the first birth rates among women in this age group. Rates rose 30 to 39.9% in 8 states, less than 30% in California. In contrast to the states with increases for women 40 to 44, first birth rates were unchanged in 15 states. Oh,
and,
2000.
Okay, thank you. But and here's a map also what's happening with our 40 to 44-year-old women.
Margaret, can I
Yes,
ask you a question?
yes, thank you, please, yes.
So why, do you know, or maybe you're going to talk about it later, but why some of the states had such a large increase, like Washington and Oregon, and other states had almost like no increase?
Well, that's kind of why I started to look into the whole, is it political?
Yeah.
I don't know.
Varies so much.
It does vary quite a bit, and when you start to look at things like levels of education in certain states, there might be some influence. Political views changing, and religious influences. So I don't really know the specifics, but those were just some of the reasons that were talked about a little bit. And please, yes.
I'm sorry, finish.
No, go ahead.
Do you know anything about the international stage, the global? Globally?
That didn't change quite as much, and a lot of that was around religion. Basically, women don't have as much control over their bodies in a lot of countries. So particularly in those places, there isn't that choice necessarily, but it is kind of a, shall we say, Western trend. But we really concentrated today on the United States, and then specifically California, because that's where most of our clients live. But we are starting to reach out and work internationally, so that would be important to find out. But there are lots of reasons why it's not quite the same. But we just experience, I think, a kind of freedom in this country that not everyone necessarily gets to experience. So, but I would be interested in hearing or getting a more specific understanding of what's happening in some of the other countries. But right now, there are just these general reasons why it's not the same. Anyone else? Any more questions or any comments?
I was chimed in on the fact that between 2000 and 2012, I know California went through a lot economically.
Yes.
It's very economic.
Yes,
Putting
thank
things
you.
off, choosing to have children when both people are working again, or both parents, or some other choice.
Absolutely.
You have more choices as a woman.
Yeah, it's true.
Okay.
Okay, so then imagine those children born in 2000 as this trend really kind of skyrocketed. They're 14, soon turning 15. So if their mothers were between 26 and 44 when they were born, there's menopause may possibly be influencing their relationship at this time. And I'm wondering, are any of you providing therapy for women with adolescents or adolescents who have mothers that are the age of menopause?
I will, they're not teenagers, but they're young.
Okay. Please share some of your experiences. If you know, have you considered menopause as part of your treatment? And if not, then, you know, let's talk about that as well.
Well, I've got it, to me, it's like classes, maybe what you said earlier, the doctors didn't say what to do about it.
Right.
And I don't want to experience so much anxiety, and I think it's genetic to an extent. But she's about 50, and they have said nothing to her, and her menstrual cycle is really changing.
Yes.
And, it's just, so we really talked about that a lot last time, and I just think it surprised me because it's such a wide spectrum when it happens.
Yes, yes.
And how it happens.
Right. There are no two women will describe their experience the same. And they won't describe it the same because no two women have the same experience. But yes, anyone else want to talk about their experience with these women or the adolescents? Okay. The stages, let's talk about the process. I've talked about the transition, but the transition, the menopause transition, really is different from the stages of menopause. The first stage of menopause is perimenopause. It is the years prior to the final menstrual cycle when most of the changes are taking place. And this could be anywhere from 1 year to 9 years that the changes are occurring in a woman's life. And menopause is actually the 12 months after her last menstrual cycle. And the myth is you can't get pregnant. Not true, because if you are believing, if you are in perimenopause and you don't have a period for 3 months, you still need to, if you're not interested in getting pregnant, you still may want to use birth control or encourage your clients to, because it is 12 months before you have actually reached menopause. So missing a period 6 months is still not enough to say that you have, yes, please, go ahead.
I was just thinking about my little sister. She was trying to have children. She kept trying to have children. And she went through, come to find out, they found out she went through menopause at age 20.
Yeah, we're gonna talk about that, yes.
Very rare.
Yes, it is very rare.
Yeah.
And postmenopause, pardon me, are the years that follow that 12-month period of having no period. And the difference between the process is perimenopause, menopause, and post. Whereas when I talk about the menopause transition, I'm specifically talking about perimenopause. And that's that 1 to 9 years. And that's what we're going to focus on today, because it is during this time that the symptoms and impairments, challenges, and difficulties are the most acute. The North American Menopause Society, NAMS, is probably one of the best organizations for you to use to gather information, for clients to gather information. It is a place where doctors, therapists, scientists have come together, and they provide articles and training and just information about this incredible rite of passage. And I will say this, because no two women go through it the same, you're going to read some information that just contradicts itself, because one professional or a woman who is having the experience is going to describe it differently. There are even different terms in some cases. So I will do my best to use the more general terms today, but believe me, you will find something different every article you read. And if you read an article or hear someone talking about it, and that same person later may even change the language. But anyway, the NAMS describes the natural menopause experience as something that occurs between 40 and 58. But some women actually experience perimenopause in their 30s or younger, and some are still having the symptoms after their 60s. My mother is 83. My dear mother, and she is still having hot flashes. Still fanning, so I made her one of these for her to use for her hot flashes. But I will say to you that, you know, to be at her age and to still be dealing with that was kind of surprising. But, you know, just be aware, 83, that she's, you know, still dealing with that. But there are other types of menopause. There's premature menopause, which is what you were talking about, your sister in her 20s. Premenopause is defined as a woman having finished and reached menopause prior to her 40s. And there are different reasons why this happens. Genetics is one. There are illnesses, and chronic stress is a major source of starting this process. And I think a lot of us in this room probably know a little bit about that as we were parenting in school, becoming therapists, and, you know, being the container for a lot of other people's concerns and issues. And eating disorders, because it changes the way the body functions. So that can even bring on premature menopause. Artificial menopause is basically when there's no blood or limited blood flowing to the ovaries, or if the ovaries have been removed. And their perimenopause period is generally a little shorter than a woman who goes through natural menopause, but the implications, the concerns, the disorders possibly are the same. So we would not want to say that she did not go through or doesn't need the same care and support as someone who experienced natural, probably more so.
I have
Yes.
a question too, because
Yes.
I went through it about 47.
Yes.
So that's early, right?
You know, again,
Well, I remember in my 30s, so could it be hereditary, you think, or?
well, genetics are involved. That's definitely one part of it, but again, stress. Really, stress is pretty, you know, that's a major reason why it could happen. And yeah, I thought that was interesting too. But like, you know, we all know that stress is just the source of a lot of problems and issues that we see. But if you had maybe an illness early in your life that didn't appear to be related, but may have somehow contaminated some part of the reproduction system, it's possible. There are some brain injuries, a little off that isn't here, but I'll mention there are some brain injuries because of the connection between the brain and hormones and things like that.
What about addiction?
Definitely an influence. Absolutely an influence on cigarette smoke, alcohol. Yeah, it's quite amazing some of the things that can influence this. So now let's talk about some of the alerts and signs that trigger us to think about perimenopause. So let's just take one of those cleansing breaths. Fabulous. And I'm going to demonstrate a couple of these kinds of things as we move along today for you to use, and also to use with your clients. Okay, I need a little bit of help. Let's have someone please read through the symptoms and impairments, and I may stop to talk about a few of them as we go. Anyone? Thank you.
All right. Symptoms and impairments. Question sanity.
Am I crazy? Literally. Am I crazy? Go ahead.
Questions identity and worth. Hot and cold flushes and flashes, most common symptom. Mood instability. Crying spells. Profound sadness. Fatigue. Irregular, erratic, and/or heavy periods. And then uterine fibroids. Bladder and urinary problems.
Okay, next page, if someone would read, please. Yeah, exactly. Why don't you read the next page? Come on, help us out. Oh, okay, so someone, yes, please.
Sex drive, vaginal dryness, painful intercourse, difficulty concentrating, anxious and irritable, heart palpitations, joint and muscle discomfort, difficulties with memory and feeling uninspired.
Okay, and there's another list. One more reader, please. Thank you.
Sleep disturbance, weight gain, family discord, relationship crisis.
Weight gain or weight loss, but more weight gain than weight loss. I'm sorry.
Weight
go ahead.
change, okay.
Yeah, weight change, that's good.
Relationship crisis, problems at work, concerns about mortality, grieving, low tolerance, anger, and somatic conditions. That's like overall phantom pain.
Right. So I'd like for you to take a moment after seeing all of the, not even all, some of, or we'll say most of the symptoms and impairments with the people at your table, and without cheating and looking at the next slide. Oh, I see you in a look. I do it. Consider some diagnoses. Now I know that it's kind of premature to start to think about that. But I remember when I was working for certain agencies, it was important that we do diagnosis early on. And we had to start that process on the phone. The phone consultation, I was already thinking about what that could be. So please take a moment, consult with the people at your table, and what diagnosis would you consider? Now, before you do that, what I'd like for you to do is to think about a couple of roles. We don't have, we need at least 4 people. We have at least four people in each group because we want a facilitator, someone to kind of make sure we're moving things along respectfully. We need a recorder, someone to write down the diagnoses that you come up with and then be willing to report that back to the large group. We want a timekeeper to kind of keep you on track so that, we're, and not talking about things other than menopause. And then a cheerleader, somebody to cheer you on and to remind you that whatever you come up with is right, it is correct. So the 4 roles, so you need at least 4 people in your group. 5 is better. If you
We could join forces with another team. Yeah.
I'm going to tell you again. Give it your groups. So we all come back together as one big group. All right. So I skipped a few slides and went straight to the client presentation. I was going to have someone read it out loud, but I think we could probably skip that because I think everyone has read it. Do we need anyone? Does anyone need for it to be read out loud? No? Okay, then. So, I tell you, I wasn't going to wear this, but it is kind of nice to have it. But if it starts to get irritating, please let me know and I will turn it off because I can speak pretty loudly. So you've read the presentation. Did you look at her symptoms? Okay, everyone look at her symptoms. And, rage I thought was interesting, which is very different than anger. It is a heightened sense. Yes.
What we call it intermittent explosion.
Yes. Yeah, really. And can manifest in many ways, rage can. So, and you noted, you know, some things that you didn't necessarily report, but things that you saw. So, before you look at the next slide, let's talk about diagnosis. So, whoever is your recorder, that is the person that will let us hear what your group came up with. So, I want to start with Ms. Lauren. Who's your recorder?
The depression, anxiety, NOS, explosive disorder, panic disorder, anorexia psychosis, sleeping disorder, somatoform disorders, OCD, bipolar, borderline eating disorder, binge eating,
Wow.
anything and everything
Wow.
other than conduct disorder and PTSD.
Oh my goodness.
Everything else.
Very interesting. Okay, all right, very good. Okay.
Oh, substance abuse and sexual disorders.
Okay, all right, and we'll jump over here.
What they said, and any combination thereof.
Okay, pretty much. That was pretty comprehensive.
Yeah, relational disorders, I don't know if you said that one.
Okay, all right, so,
We didn't throw the entire DSM for
Right.
it. Kind of said, hey, what would we really have to narrow it down to? And withdrawal and from substance abuse, specifically alcohol and marijuana.
okay.
We have almost everything else.
Okay, and
We had, dissociative symptoms, and, body dysmorphia,
yeah,
body image.
sure. Okay, I'm sorry, go ahead.
And then, as far as the communication, we have partner relationship,
Yeah.
and also with children.
Yes,
So
absolutely.
overall,
Sure. Okay, very, very good. And I appreciate that you're willing to step out there and consider some really pretty incredible things, especially here. I mean, that was a nice long list of possibilities, which, you know, that's the way we need to think about our clients in terms of what are the possibilities. We can always step back from those things. Try not to put some of that in writing if it's not true. But we can always step back. Does anyone have their DSM? Anybody?